Okay, hello and welcome to the SHISHMD webinar, How a Community Hospital Uses Health Awareness Day posts to Build a Regional Following. SHISHMD would like to extend a sincere thank you to Baldwin Publishing for sponsoring today's webinar. It is now my pleasure to hand it over to Candace Zaffarellis, Senior Manager of Content Strategy at Baldwin Publishing. Candace, thanks for joining us. The floor is yours.
Thanks, Tom. So, like Tom has said, I'm Candace Safrellis, and I'm a writer and health editor at Baldwin Publishing. I work very closely with our team to create articles, videos, and healthy recipes for hospitals that need health content for their website and their blogs and their social media. So today I'm actually talking to Amy Blaser, Vice President of Physician Relations and Business Development at Columbus Community Hospital. So can you tell us a little about your hospital and your marketing team?
Absolutely. Columbus Community Hospital is a 50-bed general acute care facility, general hospital. We're just about an hour outside of Omaha, Nebraska, and a little over an hour and 20 minutes outside of Lincoln, Nebraska. So we're in the central part of our state. When I came to Baldwin, I was at a point where I had some staff transition. And again, knowing that the SHISHMD tool calendar is an important tool in our toolbox, it was a perfect joining with Baldwin because again, we could use the foundation of the SHISHMD calendar with the Baldwin calendar, and then also create a more local community touch to some of the materials as well. So it's truly been an amazing partnership, collaboration, and a solution to our needs at just the right time.
Now that we've established, you have this content, we've given you the content for your website, why don't we talk a little bit about how you're getting people to find it now that it's there? So I know one of the things you have is a rotating tile on your homepage, correct?
That's correct, Candace. And so every strategy that we're promoting, whether it's a primary or a secondary strategy, we do have a timed rotating tile on our main homepage. And so here's just one example of our recipes and wellness content. And if you click on that, it'll take you deeper into our website. And again, that's where the source cited materials and resources from Baldwin has been so beneficial. Prior to our relationship, we were using time and resources in writing all unique content in these areas. And as the demands of the marketing team continued to grow, we really evaluated. Again, I think what we were doing prior was fine. We were proud of our work. But with this new relationship, the content, I have great assurance as to the quality and accuracy and the variety of the content that I'm able to bring to our community and those who visit our website pages.
That's great. And I know you had told me there's something else that you guys do. I believe you called it electronic communication station, and you're using it there as well.
We are. So we have a main hospital campus and then several facilities that are not located on our main hospital campus. We also have a wellness center and a field house, and we own many physician practices across our community.
That's great. I mean, that's something different that I haven't heard hospital do before, so I'm glad you guys found a way to use it that way. And I know the big one for a lot of hospitals is also social media, because you've always got to have something up there, and you want it to be relevant, and you want it to be something that's going to catch people's eyes so they click through. So why don't you tell me a little bit about what you've been doing on social media? Like, we can start with Facebook.
Yes. And so again, just as you know, Candace, Facebook is still one of our most popular and gives us one of the greatest return on investment. Our community is 22,000, and on our social media page, for example, here is a post, "What should you weigh?" And this was one that we did in the month of January. But we work, as you noted earlier in our discussion, at least 30 to 60 days out. So we're planning our strategies, and our strategies are different. Our strategies are different depending if we're on Facebook, Instagram, Twitter, or Pinterest. But again, working with Baldwin to receive our content, to plug into our plan and preload into Hootsuite. And then we always know and we always have the assurance that we have a robust platform because we depend on you to preload that. And then we customize and go back to our social platforms and bring a very enhanced local touch to some of the features as well. So we don't rely exclusively on Baldwin, and so it's a hybrid approach. But for our team, we always have the assurance that for whatever reason, if we didn't customize additional content, there always is a robust platform.
So, Amy, I know you're also using the content on your other social media platforms. I know you'd mentioned Twitter was one of them you're using as well.
Yes, Twitter is a growing platform for us. And again, the audiences that follow us on these various platforms do vary. But again, the content is very universal, and we found good ROI on using it across all of our social channels. So again, Facebook is one of our first social media platforms that our hospital has the longest history with. But as we've expanded into Twitter and Instagram and Pinterest, we've found that the content has been very effective for all of the various audiences that we reach in these areas. And so this is an example that you're seeing now of a Twitter post, very typical of the Twitter location. And again, we are seeing great a great use for this content in that space as well.
That's great. And I know you've talked about that you're dabbling in Pinterest. I mean, I know you guys have had a strategy in the past and you're looking to do more. So can you tell me a little about what you've been doing there?
Absolutely. I mean, this is where I'm really excited about for our views and our reach and our interaction and some of our saves. But again, this is a great example of how the recipes come into play. So our strategy, as a community hospital, we do for our community health needs assessment and some of our corporate goals is to address adult and childhood obesity. And again, health and wellness space is a great place to do that. And so we've really defined our Pinterest space to promote recipes. And so, for example, earlier this month, we had our American Heart Association Go Red for Women event. And that brought in hundreds of women to an event to receive education on heart health. And the ways that we participated is sharing recipes with all women that were in attendance, again, encouraging them, if you love this heart healthy recipe, follow us on Pinterest for more recipes like this. And again, a lot of the recipes and health content that Baldwin is able to provide to us, our dietitians have reviewed much of the material and it meets to their approval as well, our physicians. And so I'm just really proud of how our team has used Pinterest for the heart health, for just health and wellness and recipes in general. And this is a great example of one of our posts. And so it works well to use the space for this and use the content and the space in this way.
Yeah, and I know in general, recipes, especially with very vibrant images, that's what always drives traffic on Pinterest. So it was definitely a good idea to do that.
Yeah, it's really how we're using our page. And again, you can imagine when we go to health fairs and different community events, and even our health tips. We have an all-employee newsletter and we have email blasts that go out to our community weekly. And these recipes, this is beautiful imagery, and the recipes are really yummy too. So we've tried the recipes that you've created for us, the content, and our public is really excited about it. And so again, it's just this is something that we probably wouldn't have had the capacity to do ourselves. And we're really, really proud of this. We also have a cooking kitchen, a demonstration kitchen in our wellness center. And so we have food classes and cooking classes. And so being able to go to the library and pull out ideas for content through Baldwin has been very beneficial as well.
Yeah, that is definitely a great idea. And I think you guys are working on some other strategies coming up as well. Do you want to share a little bit about, without giving too many secrets away, what you guys are planning?
So we're getting ready to launch some new programming with podcasting and different things. And again, we're hoping to, have our physicians again reference some of the Baldwin content to augment some of the themes of what they'll be promoting on their podcasting as well. So stay tuned. I'd love to come back and talk to you about our success in those areas. We're not an expert by any means in those areas, but super excited to grab the Baldwin content and take it with us in those spaces and really think, strategically on how we can maximize the usage in those spaces. So stay tuned. It's going to be fun.